Hello friends, today we are going to discuss a very important topic and that is regarding cancers in women. As you already know, cancer is among the leading causes of death and disability other than heart attack and strokes. And we have seen recent reports of cancer incidence increasing in India and including in women also. So to talk about cancers in general in women and also regarding breast cancer, we have a leading expert with us, Dr. Rashmi Sudhir. She is a breast imaging specialist and intervention specialist currently working at Apollo Hospital in Hyderabad, and she has more than 15 years of experience in breast imaging and onco imaging. So Dr. Rashmi, welcome to this program. And to start with, I want to ask you the question, is the incidence of cancer really increasing in India, especially among women, or is it only a media hype?
Yes, so definitely number of cancer being detected is going up. In last 10 years, there is significant rise in number of breast cancer cases. Recently published data in 2022, they said that in 1 year, more than 1,92,000 breast cancer patients were diagnosed alone, and it is estimated to be crossing 2,30,000 in year 2025. So if you compare the urban and rural areas, one in every 22 women in urban population is likely to develop breast cancer during their lifetime, and it is going to be one in every 60 women in rural areas.
So this definitely looks alarming, but there is no need to worry because we know that there are many modes of preventing cancer. So can you recommend some tips to women what they can practice and try to reduce the risk of breast cancer?
Yes, definitely. There are certain modifiable risk factors like change in lifestyle. So, if they follow healthy lifestyle like healthy eating, healthy diet, avoiding alcohol consumption, avoiding smoking, ultra processed food, by following uh, weekly physical activity like they should do at least 150 minutes of moderate to intense physical activity, and they should do adequate breastfeeding, having childbirth before age of 25 to 30 years. So these are the protective measures which can be applied and can reduce the breast cancer by 30 to 50%.
So that's amazing. So it's not like you have to fear. So once you practice a healthy lifestyle, that is eating healthy food, exercising on a regular basis, sleeping adequately, avoiding smoking and alcohol, and other things that you mentioned, marrying on time, having kids on time, breastfeeding. So many of these things can be practiced to reduce the risk of breast cancer. Now, of course, people may want to know whether they have cancer or not. They may have symptoms, may not have symptoms. So, what are the methods which women can use, to detect cancer in early stage?
That's very important because screening detects early cancer, which saves lives, and it saves breast as well. So, women who is more than 40 years of age, by default, whether they're symptomatic or asymptomatic, they should go for the mammography screening once in a year or once in 2 years. Second, women who are more than 30 years of age, they can go for clinical breast examination, which is done by the trained healthcare staff. And this facility is available everywhere in urban as well as in rural areas. So even primary healthcare centers, they have trained healthcare staff who can do clinical breast examination. If they are found to have any abnormality in the breast, they will be referred to the higher center for the further evaluation with the mammography screening. Third, again, every woman can do themselves, that is breast self examination. Every woman who is more than 20 years of age, they can do once a month. They can fix a date like 5th or 7th day of the menstrual cycle. They can do self examination with their hand. If they find any lump or any abnormality or recent changes in the breast, they can inform to their doctor, who can ask for the further evaluation with the imaging.
There is one doubt many people have is that risk of radiation with mammography. Is there a real risk of radiation exposure with mammography?
There is very minimal risk of radiation, that is zero point 0.02 millisieverts, which is equivalent to the 6 weeks of background radiation exposure. So when normal people, they are getting exposed to radiation, so but the benefit of getting mammography screening done is much higher than the risk, and this radiation exposure is well within the US FDA approved limit. So no need to worry about radiation exposure at all. They should go ahead with the mammography screening at least once in a year or once in 2 years.
So, dear women, as you heard, mammography is safe and you must undergo mammography as per the guidelines and recommendations which Dr. Rashmi just described. Now, on mammography, if you pick up something suspicious, and or if it is normal, that's a very good news. But if it is suspicious, what further tests women need to undergo to confirm whether it's a benign lesion or whether it's a cancer?
So if a woman is found to have certain lumps in the breast on mammography examination, and it looks suspicious, which could be cancerous, so in that case, we ask them to go ahead with the core biopsy. That core biopsy is done by the radiologist under image guidance. We take a small tissue from the lesion which is suspected, and after taking the tissue, we send to the pathologist. Pathologist gives the final verdict whether it is cancerous or not. If it is non-cancerous, women goes with happy face and they come for the routine screening. If it is cancerous, then we refer them to the oncologist for the treatment.
Yeah, thank you. As you mentioned, cancer, they need to see oncologist for further treatment. But I heard that women who have benign lesions, especially of a particular size, you are doing a procedure where without surgery, without scar, they can be removed. Can you mention briefly about that technique?
Yes, there is a recent advancement and there is a new technology called VAB, or vacuum assisted breast biopsy, or vacuum assisted breast lump excision, which is done on OPD basis under local anesthesia, and it is painless procedure. Through a pinhole, a needle is introduced. That needle cuts the lump very precisely. It is done under image guidance, and within 30 to 40 minutes the procedure is completed and women can go and join her regular activity on the same day. There is no scar on the skin. There is just on 2 to 3 mm of pinhole, which will heal within 2-3 days.
I think at this point, I would also want to ask you, what are the common symptoms which a woman should not ignore in the breast, and they need to see a doctor or a radiologist for further evaluation?
Yes. So the commonest symptom is breast lump. The tricky question is that many women, they come and they say there was a lump, but they ignored it because it was completely painless. But let me tell you that most of the breast lumps which are due to breast cancer, they are painless. So any painless breast lump they should not ignore. They should consult their doctor and get evaluated. Second commonest symptom is blood stained or watery nipple discharge. They can also feel lump in the armpit. They can see recent changes in their size or shape of the breast. They can see that nipple, or around the nipple there can be some scaly or dryness, itching. All these can be symptoms of the early breast cancers. Sometimes they can also see diffuse breast enlargement or skin thickening like orange peel. So all these things, if any of them they find there is changes in the breast, they should inform to their doctor and get evaluated.
And one final question to you is, by this screening mammography and other screening techniques, does it really lead to better outcomes and save lives?
Yes, definitely. Early detections not only saves lives, but it also saves the breast. By early detection, we are trying to detect the cancer in stage 0 or stage 1, when just by doing breast conservative surgery under image guidance localization, small area can be removed from the breast, and most of the time if it is in stage 0 or stage 1, they can be cured, or some of them they may need oral treatment or very localized radiotherapy. So early detection, definitely survival rates are more than 90%, and chances of having any breast deformity is minimal. So definitely early detection through mammography screening saves life.
Thank you, Dr. Rashmi. And today you have answered many questions which are always in the minds of many viewers and general public. I am sure they learned a lot. But even after this, if the viewers, if you have any more comments or queries, please post your queries, and Dr. Rashmi will be happy to answer them at a later date. And then please share your feedback also. Thank you. Have a good day.
Thank you.